I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and welcome back to Your Health radio and television program. I'm so glad you could join us for our next segment because I have another very special guest, Darlene Voss from Optimal Wellness Nutrition. Darlene Voss, thank you so much for being here.
And thank you for having me.
Darlene, I want to talk about nutrition, and this is a segment where you're going to teach me a lot, so I love these segments where I learn from people. So let's start out by talking about your company or what you do, Optimal Wellness Nutrition. So tell me about this.
I basically take a look at the body in whole and the diet in whole and also lifestyle as well in order to see how we can improve diet and lifestyle to enhance someone's life in general. So I look for, I don't diagnose and I don't treat, but I do look for weaknesses within the body, and I take a look at the diet and see how we can reconstruct things in order to better support those systems.
Well, Darlene, is it true? I guess I need to ask you, can we believe that through diet and nutrition we can actually change the health of the body or the way someone feels? Like,
Absolutely, absolutely. If you've heard of biochemical individuality, every process within the body has a chemical reaction, and you can affect that by changing the nutrients within your diet and then also supplementation as well.
Okay, so let's talk about that more specifically. And actually, let me ask you another question before we get to those specifics. Can you tell me about how you got into this field and what sparked your interest in nutrition?
Oh, it's a very personal story to me, and it's dear to my heart. My grandmother, who is thriving at 85 years old with congestive heart failure, she was in the hospital, and I was visiting her there for a number of days. And at the time, I was in a banking career, and I was there with her with no other intention of just supporting her. And during her last day there was a dietitian that came in, asked her about 10 questions or so about her diet. You know, does she eat whole foods? What kind of food does she eat? Put in a video with regards to congestive heart failure. And my grandmother, nervous for being in the hospital anyhow, she's basically only been in the hospital for her children, and that was it, and was uncomfortable being there, really did not comprehend the video that was shown to her. And after the dietitian left, she was left with a blank look on her face, like, what good would that do me? So I answered a few questions on the behalf of my grandmother for the dietitian with regards to whole foods, because, put in context, my grandmother didn't know what a whole food is when asked questions. And I answered a few questions for her, and then, the dietitian left, and I thought, there has to be more of an effective way of reaching out to people who are sick and in pain and really need a diet and lifestyle change. And that's when I got interested in nutrition.
Well, Darlene, that's fascinating to me. So what that's going to lead us to is that there's a whole field, and you believe that through diet and nutrition we can actually affect affect the biochemistry of the body? Or
Absolutely.
Just the way someone heals or gets prepared for surgery or a stress in their life? Is that?
All of the above, yes.
Okay, so before we get to nutrition for the medical patient or surgical patient, what about someone who, say, just wants to feel stronger or have more energy or improve their lifestyle? Is that someone that you can counsel or go over their eating habits with them?
Yes, absolutely.
So how's that work? Do they call you, or do you see patients in their house or their home? Or
I actually like to come to my client's home for a number of reasons. Usually when people are in their own setting, they're more comfortable to talk about some very personal questions that I'll be asking about digestion. And also to take a look at their kitchen and how they really eat and what they do, and we can talk about meal times and how they prepare food. And so I actually really like to come to my client's home in order to interview them.
Well, Darlene, you can barely pick up a magazine or a newspaper or turn on the television these days. You can barely tune into anything and not hear about obesity in America and how children are overweight and adults are overweight. Now, is that something that you can counsel people about losing weight, or do they need to see?
Absolutely.
Oh, so you can do that?
Yes, and children, having a young one myself, I understand the challenges that parents have these days with all of the processed foods that are on the market and the refined foods that are on the market, and children are drawn to and in some cases addicted to those foods that are devoid of nutrients. And the reason why we eat is to supply each and every one of ourselves with nutrients so we can survive.
Well, Darlene, that's fascinating to me. So let me give you a couple examples, okay? Let's say we've got a 30-year-old guy or gal, a man or a woman, and let's say they just feel like they have a lack of energy, they kind of feel tired, and they want to know, and there's no illness involved, but they want to know if there's something that they can do through nutrition or their diet to sort of make them feel more energetic. Can you see a person like that?
Absolutely. And you know, everyone is different, and there is no one recipe for somebody who wants more energy. I go back and I take a complete health history. I ask questions all the way back to their childhood. How healthy was your childhood? Did you miss a lot of school? I mean, I go way back. I also go into the family to see if there are any chronic illnesses and the possibility of finding weaknesses within their own body and addressing and supporting those weaknesses of organs such as liver, kidney, stomach as well, and intestinal digestion. And so I go way back and try and find these weaknesses and then address the goal that they want to achieve.
Darlene, you know, we've all heard that old adage that you are what you eat, right?
Absolutely.
Now, do you believe that the way a person eats or what they eat can actually affect their well-being and their biochemistry, etc.?
I have no doubt about it.
Okay, so let's talk about, well, let's kind of shift gears a little bit. Say it's an older person, say somewhere between 60 and 70, and they feel that they're followed by their medical doctor and they don't have any medical problems that are out of control, but they want to, say, embark on a more healthy lifestyle. How do you approach a person like that? And what are some suggestions that you can make about the way they eat or what they eat?
Sure. The first thing that I do is I take a look at what they're doing currently. Are they eating whole foods? Are they eating refined foods that are devoid of nutrients?
Well, so, excuse me for interrupting, but let's talk about what do you mean by a whole food and what do you mean by a refined or processed food?
Very good question. A whole food is a food that can be consumed as close to nature as possible. So if you can think of going out to an orchard, picking an apple off the apple tree and eating it, that's a whole food. Now, if you were to go into an artichoke orchard and try and pick an artichoke and eat it, you couldn't eat it. You'd actually have to process it, cook it in some way in order to eat that food, which is still as close to nature as you can possibly get with that particular food. So an apple, picking that off the tree, whole food. Artichoke, processing it by cooking it and then eating it, still as close to a whole food as you can possibly get. A refined food is, let's take a cracker for an example. A cracker does not resemble a grain if you were to eat it. And does your body recognize it? How many additives are in there? How many preservatives? How many chemicals? How many toxins are in there in order to preserve that food? It takes the body, sometimes it takes the body more nutrition, more nutrients to process a food that's devoid of nutrients than the food is actually adding to your body. Does that make sense?
It does make sense. So it sounds to me like one of the suggestions you would make to a person is that they eat more whole foods or eat more unprocessed foods. Is that correct?
Correct.
Okay, so let's shift gears for a little bit. Let's talk about the surgical patient.
Okay.
My audience, I think by now, knows that I'm a plastic surgeon. So what about the person who's going to have, say, an elective operation? They're planning on having an operation and they want to feel like they're building up their nutrition. Can someone actually do that?
Absolutely, absolutely. I suggest prior, obviously, most people that are going into surgery with you and sometimes with other physicians know of the date that they're going into it. I would suggest before the date that they go into it, you know, have some sort of idea what your body needs in order to heal. When you talk about a wound, either internal, like a sprained ankle, or a wound that's external, like what you would need to do to go into the body, there's always inflammation and pain. Inflammation comes along with healing, because what happens is the body rushes fluid and nutrients to the site in order to heal. And if you have the right nutrients in a good supply, in addition to fluid, water is a very important thing. If you have the right nutrients in order to heal, you'll heal much faster with less discomfort, hopefully, and less pain.
So do you feel you can actually help people, say, recover from an operation more quickly or more efficiently? Do you think that actually works?
More efficiently, yes. And more quickly, and hopefully with less pain. Yes, absolutely.
Well, is there a way to, say, help reduce swelling and bruising and help people minimize inflammation, whether they're injured or go through an operation? Do you think it's capable to do it? Do we have the ability to do that?
We do have the ability to do it. In a lot of my research, there are a family called flavonoids, and I'll refer to them as a family because there's not just one particular flavonoid that is good for you, but they're also referred to as PCOs. And you can find these PCOs, the flavonoids, in different fruits, such as strawberries, blueberries, red wine, for example, although there's a counterproductive thing going on there with the wine. Also in citrus fruits and things of that nature. Increasing the flavonoids helps the body initiate this mechanism that will essentially get rid of debris in the body, things like carcinogens, mutanogens, like that at cancer level. Talking on a cancer level, they certainly have been known to help with cancer as well. And it just basically helps the body eliminate things that are not supposed to be there. So when you look at healing, in the process of healing, the body is not only repairing the damage, but it's getting rid of particular cells that are dead. And in order to do that, to facilitate that action, flavonoids is, as an example, a very good nutrient to concentrate on.
Now, I see. Now, Darlene, you used an abbreviation. Did you say POC?
PCO.
Oh, PCO.
Yeah. And that basically refers to a family of flavonoids.
I see. Darlene, I recall, I think that most of us who grow up in America have heard about the 4 basic food groups, right? Mm-hmm. There's dairy, and then there's grains and fruits and vegetables, right? And then there's the meats and proteins, right?
Right.
And I think as we grew up, we were taught or we learned, as long as you have a variety in your diet and you have enough of the basic 4 food groups, then you're going to be fine. Mm-hmm. But I think since then, it seems that, you know, in one year, we hear milk is good for you, and then the next year we hear, no, you're not supposed to drink milk. And then it comes back that milk is good. And then red meat's good, then red meat's bad, and drinking is not good, but then 2 glasses of wine is great for you. Mm-hmm. So how does someone help to sort all that stuff out?
I think the difference is when you talk about the food groups is the micro and the macronutrients. The macronutrients are your proteins, your fats, and your carbohydrates. We all need those in particular levels to survive.
Okay, now that's important. Can we go over that again?
Sure. The macronutrients are your proteins, your fats, and your carbohydrates. And
okay, so the macro
mm-hmm.
are, I'm going to hear this again because it sounds so important.
Sure,
the proteins
mm-hmm.
and the fats and the carbohydrates.
Mm-hmm. Every body, every cell needs a particular ratio of those, and it's all different within different individuals. But we all need a particular ratio of those in order to survive. There is carbohydrates basically produce energy. Protein can produce energy as well, but its basic function is to build the body with amino acids. And then, of course, fats. A lot of people that come to me are afraid of fats, when in fact every cell in your body needs fat for it to be stable, to keep its shape. It's important.
So everybody needs some fat. Mm-hmm. And of course, I guess we all hear about we need proteins.
Yes.
Right? But now there's a lot of people on the so-called low carbohydrate diet, right? Mm-hmm. We sort of hear now that too many carbohydrates are not good for you. Mm-hmm. Is that right? Now, do you talk to people about that? Can you counsel people about?
I do talk to people about that, and I think understanding exactly what a carbohydrate is and which ones are good for us and which ones could potentially be harmful for us is the way to go about it. If you look at if you look at a cupcake, for instance, which is pretty much made with white flour and sugar and some eggs, you got some protein in there as well. It is not, next I'll have to talk about micronutrients as well. It is not filled with vitamins. It is not filled with a whole lot of fiber. But if you, and a cupcake is a carbohydrate, but an orange is also a carbohydrate as well. And so if you're going to eat a cupcake, you're not going to get any vitamin C. You're not going to necessarily get a whole lot of fiber. But if you switch the type of carbohydrates that you eat, A, your body knows how to process the whole foods much better than it knows how to process refined foods, and therefore your digestion improves. And B, you receive more micronutrients, which is what we haven't talked about, and that's the whole vitamin scale, you know, A to Z, plus your minerals and fatty acids, and etc.
Darlene, that's important. See, I interrupted you. So you were about to explain what you mean by micronutrients, correct? So we've talked about the macro, protein and fat and carbohydrate. Now, what are micronutrients? Micronutrients
are all of the vitamins that are contained in foods that are nutritious for you, of course.
Okay. So, and Darlene, I could go on talking to you for hours, but we've just got a couple of minutes. So, another question I want to ask you before we conclude is: there's a lot of people that take vitamins and nutrients and supplements. What's your take on that? If people just eat right, are they doing okay, or do you oftentimes recommend supplements and vitamins to people?
Supplements and vitamins, yes, sometimes, but it really depends on the quantity and the quality, because there are vitamins out there that cannot be absorbed through the digestive system, and essentially it's not doing your body any good to take a vitamin if it's not absorbed through your digestive system. So the quality and the quantity is certainly helpful. What I like to focus on most of all is getting your nutrition from food, because your body knows how to do that naturally. That's what it's supposed to do.
I see. Darlene, I've got one more question for you, and this is kind of a tough question.
Sure.
You know, as a surgeon, and since I trained here in this country, you know, I rely upon science for the advice I give my patients. Now, do we have data or evidence? Is there research that the proper nutrition can actually help with healing and help people have more energy or deal with a stressful life? Do we have evidence of that?
Absolutely, and there is a foundation, the Western Price Foundation. I'm not sure if you've heard of him. He was a dentist quite some time ago, and he did a lot of study around the world with different cultures and their diets. And if somebody is looking for research, I really suggest that they Google the Weston Price Foundation. It's a fantastic resource for people who are looking with regards to evidence on diet. And what's important, what he does too, is different cultures and different diversities different bodies need different things, and he discovered a lot of that.
Well, Darlene Voss, I so appreciate you coming on the program. This is fascinating to me. I could go on for hours. Optimal Wellness Nutrition, Darlene Voss, V-O-S-S. Now, would you like to give out a website or a phone number in case somebody has questions?
Sure. The website is very easy to remember, if you can remember the name, optimalwellnessnutrition.com.
Darlene Voss, optimalwellnessnutrition.com, all one word.
Yep.
Darlene, thanks so much for coming on. It's fascinating nutrition.
Thank you. Thank you for having me.
It's been my pleasure. I am Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to take a very brief pause for a very good cause. We're coming right back. Please stay with us.